Okay, well, we just got a couple of hygiene questions. Some biological dentists will say use to do regular flossing, and others will say no, use a water pick and with hydrogen peroxide. What is your opinion on that? And then any recommendations on toothpaste?
So the key to the mouth, I mean, brushing your teeth is important. You're removing biofilm food. I mean, there's a reason we brush our teeth. It's hygienic. But really you're trying to do things that optimize the oral environment so that the biomes can be optimized and be self-sufficient, and you don't want to tip that too far out of balance. And so toothpaste, over the counter traditional Crest, Colgates, whatever, the top few ingredients are typically surfactants and bubble and surfactants that make your teeth feel smooth, foaming agents. So that's the sodium lauryl sulfates and the propylene glycols that make bubbles, and they make you feel clean. There's not a lot of therapeutic benefit to those. And some toothpaste, actually, they're still putting trace amounts of antibiotics in, which you really don't want, because you don't want to disrupt the biomes. It may not. I mean, people use these toothpastes all the time, and it's a non-issue, but you just want to be careful with that. I think the best probably recommendation we make is just a mixture of baking soda and salt. And you can use peroxide. We do a little analysis of the bacteria in the mouth. You can look at a sample slide under a microscope and get an idea about the proportions and the amounts and what kind of bacteria, do you have high risk bacteria or not. And then based off of that and their hygiene practices, you can make recommendations. So if you see a lot of anaerobic activity, periodontal pathogens. Now, what I mean by that is these are now bacteria that are in the mouth, in and around the teeth, in the gums, the pockets of the gums. If you see a lot of negative high risk bacteria or disproportions, that's where sometimes we do recommend hydrogen peroxides and different types of oils, ozonated oils. You can use essential oils, oil pulling, baking soda, water picks. So to answer your question, water picks are great if you've got areas that brushing and flossing isn't going to get down into the bottom of a pocket. If it's an area that's hygienically unserviceable, those water picks are great because it'll actually get in there and flush out, and you can deliver the peroxides or whatever you choose to put in the water picks.
Do you think flossing is too aggressive for the gums, or do you think flossing is great, or
So there was I got a laugh out of this. About 3 or 4 years ago, there was a study that came out, and it actually showed, it proved scientifically that flossing has very little, if any, effect on the progression of dental decay.
Really?
Yeah. Now, if something makes a lot of sense, it's you don't need science to tell you that something is good common sense.
Right.
I don't care if it's proven by science or not. So, flossing removes food and debris, get it out of there. I mean, flossing is good, but I think that actually helps promote this other theory of how tooth decay progresses. Is there's sometimes there's things outside of just normal hygiene that can influence how quickly, say, a cavity does progress. And that's what we discussed earlier, is all of the things, diet and inflammation and liver health and on and on and on. So basically they said that flossing is still a good idea, but in this big study,
the ultimate deciding factor in cavities.
Yeah. So, I mean, but, obviously flossing is good to do. I still recommend that patients floss their teeth. And then water picking is good. Most of the time with oral irrigators, water picks, I think it's good for everybody, but especially patients that have more issues with the progression of periodontal disease. So you're actually getting breakdown and significant inflammation of the gums around the teeth, to the point to where you're actually getting pocketing or you're getting bone loss. And what that does is it creates a lot of areas that are really hard to clean. And so in a patient's mouth who has some of these advanced bacterial slides, and we're seeing significant inflammation and breakdown of the whole periodontium, that's where water picks are great, because you can deliver well, I say medication, peroxides. You can use colloidal silver, essential oils again. You can use certain types of clean oral irrigating solutions, but you can deliver those into these sites that you normally wouldn't clean and cleanse, and that can help to slow down the progression of the inflammation and problems in the gums. So,
oh, very good.
yeah.
That is good to know. Yeah, so I've been making my own toothpaste for years now, and it's with bentonite clay, baking soda, coconut oil, and essential oils, and also some calcium carbonate.
Yeah.
And that's been working great for our family. Sometimes it gets like you have to just use a little bit, otherwise it'll clog up your sink because of all the coconut oil. And I'll put a link to the recipe there for the viewers. But that's another. I think that's a great way to avoid, going with the Colgates and the Crests and all those that have ingredients that aren't really helping with remineralizing your teeth.
I'll say this real quick. I'm not opposed to xylitol. You see that in a lot of products, but there has been some would say, because xylitol does disrupt biofilms. I mean, you'll hear dentists will promote it. They'll say it's antibacterial.
Mm-hmm.
Well, again, that may be true, but how much of that do you actually want to disrupt? Do you want to promote the
good bacteria? Yeah.
And you can, I mean, anybody that's eaten too much xylitol knows that the effects of that. It can cause a lot of GI disturbance because it really disrupts a lot of the biomes, and you can get a lot of GI disturbance and problems. Well, a lot would say xylitol is okay in dental products, but you can do too much. And another thing that I thought was interesting is, where's the xylitol sourced from?
Right. Is it GMO corn, or is it, because there's the birch bark and then a lot of it's GMO corn from what I read.
Yeah. Yeah. So a lot of these real healthy toothpaste that, remove a lot of the bad stuff, say xylitol, and which, I mean, okay, it's going to be impossible. It's hard to totally shelter ourselves from everything negative that we come into contact with, but people that try real hard and it's a priority and they spend a lot of time and effort and cost removing these things from their lifestyles for good reasons. And that can be a real sleeper, because most xylitol, it's an alcohol produced from corn cobs on an industrial level. It's not somebody out there scraping a birch tree or whatever.
Right. Yeah.
And so it'd be important to just watch that in any product, not just toothpaste, but any product, any sweeteners, any food products, anything. Just
well, that's good to keep. That's a very good note. I'm glad you brought that up, because I think some people really do think xylitol is great, and so it's good to be mindful of that as well.
Mm-hmm.
Well, great. Well, thank you so much. This has been super amazing and interesting and informative, and I think there's going to be a lot of people that really benefit and learn a lot, from what you've shared. So thank you so much. If any of the viewers are in Texas, Dr. Stanley, you can find him at stanleydental.net. And for more great videos, make sure you like and subscribe to my YouTube channel. And of course, for lots of healthy diet, back to the earth diet and lifestyle tips, you can go to my blog at barefootinthegrass.org. And so this has been really good. Thank you, Dr. Stanley.
Good. Appreciate it.